Hey everyone, I'm Lindsay Hoffman and welcome to the Dose of Bliss show where we give you daily doses of bliss to live your best life. And today I'm so excited. We have a family medicine doctor. She specializes in functional medicine. You guys love my videos about curing chronic illnesses, so we're going to tell you all the best tips. Today I have Dr. Yerel Patel. Yay!
Thank you. It's a pleasure to be here, and I'm so excited to answer some questions and give some valuable information.
Yeah, I'm so excited that you're here. As I was saying, everybody has loved all my blog posts and videos about me dealing with chronic illnesses and how to fix it. So I had to get an expert. So let's just start out with what you do, what kind of doctor you are, and how that's different.
Sure. So what I do that's different is usually I am a family medicine doctor. But I try not to be just your normal doctor. I usually have my patients see a family medicine doctor, get the routine screening, and then use me as a specialist. Because a lot of times your blood tests and things like that, you'll think everything's okay, but there's more that I can do if you come to me to investigate further what's causing your chronic illnesses.
So what's an example of a chronic symptom that a doctor might not notice?
So, for example, something that's really common is stomach pains, gut issues. So you'll have like bloating and diarrhea, constipation, just not feeling well in the stomach. And when we do a set of standard routine tests in normal medicine, it says that everything's okay. But you as a patient know that you're not still feeling well. So we look closer and we actually analyze the gut by looking at the gut stool testing, which looks at like 4 different pillars of what could be wrong with your gut and causing your symptoms.
So what things are normally overlooked? Because, I've been it through myself. I've been to so many doctors, and all my tests would come out perfectly normal to the point where they're just like, you might have IBS. You Google, what is IBS? Unknown cause. Are they missing? What aren't they testing for?
So what they're not testing for is specific things like, do you have an actual infection in your gut? When they do test for it, they're just looking for simple, normal things like simple parasites you would find, very common ones. There's like a dozen of them, but they're not the only types of parasites that actually that exist. They're just the ones that they're most used to. But some of us could be the exception that travels more often, eats different types of foods. You can get a different type of infection that's causing your symptoms. Also, you could have an insufficiency of something, and that's something they don't look at. You could have low good gut bacteria, or you could have too much of something that's causing, harmful to intestines, what people call SIBO, small intestinal bacterial overgrowth. So and people just take probiotics just for the heck of it, but you need to know what you need to take before you actually take something that's going to either help you or harm you.
Mm-hmm. So probiotics could harm you if it's not the right type?
Absolutely. For example, there is a specific condition called small intestinal bacterial overgrowth. And if you're just one of those people that just pops pills or pops probiotics back and forth, but you have an overgrowth already, then it's actually going to make your symptoms worse.
And is there a complete difference between bad bacteria and good bacteria? Because I was researching this and I heard that they're not so different as we think they are. There could really be an overgrowth or either, or one's just more opportunistic than the other. What's the difference?
So you did your research right. You're absolutely correct. So when we analyze the different types of bacteria in the gut, there's 4 that are really good, and we want to make sure that you have a lot of that, or you're maximize on that. Usually, common ones that you would recognize are like lactobacillus. That's the one that's found in your normal probiotics. Bifidobacterium. Those are 2 that are very common, and that one, the more you have, it's actually good for you because it's protecting. There's over 100 other types of bacteria that can be good or bad, depending on the environment in your gut. We don't really worry about them too much as long as the other good ones are more prominent in your gut.
Mm-hmm. And back to the blood test before we get further, how can someone who has a perfectly healthy blood test, everything come out fine, still have problems?
So that's a great question. And the reason is because a lot of times, a lot of your hormones in your body, a lot of the enzymes in your body, in order for them to work, they actually need micronutrients, they need vitamins and things to be activated. So you could have a blood test that shows every number, like you have enough of everything, but do we know if they're functionally working? You could just have a whole bunch, and the example of that would be thyroid patients. A lot of people who feel tired, who have thinning hair, weight gain, they have normal thyroid levels, but we are checking not the active form of thyroid. We're just checking a different form of thyroid. And that if that normal form of thyroid does not get converted through the active form of thyroid, it's not doing you any good. And enzymes like selenium, zinc, and magnesium actually help convert non-active thyroid to active thyroid. So you really got to make sure that you have those enzymes to help. And routine blood tests don't check those small little enzymes, which are actually very useful to helping you.
So what should we be asking our doctors? Because I go into the office and I'll be like, I'm that percent that everything does not show up. What are the tests? And they're like, calm down, you're fine. It's probably stress, blah, blah, blah. What can I come in with and tell them so we can get these things looked into?
So in corporate medicine, or the way that healthcare is right now, a lot of these extra testing are not usually covered by insurance, and then a lot of doctors will not prescribe them. So what you want to do is find what they call like a functional medicine doctor, or somebody
Like
who
you.
Yeah, exactly like me, or somebody who can actually dig deeper for you and look at like the actual underlying causes, like micronutrient testing for just overall well-being, gut testing, which is a stool test that looks at all different aspects of the gut for anxiety and depression, actually looking at which neurotransmitters in our brain are imbalanced. And then you can do natural ways of calming that down, or you can take supplements, which can help too. So there's a variety of tests that you can do that dig deeper and look at the underlying cause.
What's like the most shocking thing you found to be a cause of something simple, like maybe stomach issues or even depression or anxiety? Is there something like shocking you found where you're like, wow, that's really random or surprising that that's the cause when people are just usually giving medicine for it?
So that's a great question. And to me, it seems really easy, but it's diet and nutrition. There are so many minerals and so many enzymes and good micronutrients in a good, proper diet that will pretty much help any ailment if you get the right amount in. And sometimes everyone's that has so many restricted diets now. There's paleo, there's vegan, there's vegetarian, there's like low carb. Everybody has a means of wanting something, but all those diets are going to have restrictions in certain micronutrients that we need to feel overall really good. So just really talking to a doctor who knows more about diet and nutrition and incorporating that so you're getting everything that you need to kind of help with your symptoms.
So that's like actually a big thing. So I read this somewhere. It's kind of like how everybody's body is a different ecosystem. So people keep hearing different types of diet, but that diet might not be for you. Can you explain how people can find out what that means and how they can find out what is for them?
Yeah, so the best way to do it is sometimes we do trial and error, and I don't recommend that way because we'll do like a paleo diet, we'll lose a lot of weight, we'll feel like we look good on the outside, but the inside we're still kind of suffering. The best way, again, is to kind of find either a naturopathic or a functional medicine doctor who's going to kind of see through like genetic testing or testing your genes, testing what's going on in your body, and then curating a diet according to what they find versus just doing a shotgun method of, I'm going to try this diet, I'm going to try this diet, and then it can actually harm your body if it's not the right diet for you.
And you don't even know, and maybe that's why you're
Exactly.
getting headaches. Maybe that's why you're tired all the time.
Exactly.
Maybe that's why you don't feel good, and who's going to tell you that,
Exactly. So for that type of person, so I always tell patients to be an advocate of their health. You know when you feel your best. And just because you're getting older doesn't mean you have to slow down and not feel good. If something's missing, if that's happening. So seek out a specialist. Don't be afraid. Seek out a specialist. In California especially, we're so blessed that there are so many functional medicine doctors that can help. So just make sure you get out there.
And earlier we were talking about an example with you. Can you share that example about how your tests are normal, but you found something else? Because I think that's a really great example to show people what they need to be looking for.
Sure. So I always pride myself. I was, when I was in medical school and as a family medicine doctor, I was like, okay, I'm always going to get my routine blood test done. So cholesterol, blood sugar, electrolytes. And I was always proud of myself because my cholesterol, I was like, okay, that's good. So I can, sneak in an extra cupcake now and then. And, I can slack off on the exercise a little bit. But then I realized, and then routine blood test, I was always normal. But when I took a different advanced test that looks at the actual little molecules and enzymes that can be high if you're starting to have a heart attack, I realized I have a gene that makes me more prone to having sticky vessels, that makes me more prone to having a heart attack, even though I'm only like 36 years old. And that boggled my mind because I was like, wait, all these years I've had a normal cholesterol panel, but now there's something in my genes that's going to make me more prone. So that alerted me that I have to change my lifestyle. I have to start, taking turmeric or something that's going to kind of thin out my blood a little bit, make it less sticky. Exercise has to be something I can't really skip out on anymore. It's because I have to be more aggressive. And if I didn't make these little changes, if I never saw that little test, which is actually available, your routine doctor cannot do it. You have to get it from a functional medicine or specialized test. But if I didn't know that, I could have been one of those people that had an early heart attack in their 40s or early 50s and never known, and just thought their whole life, I have perfect cholesterol. But without looking at it through a microscopic level and seeing what's actually going on in my heart right now, and mine was based on my genetics, then I would have never known, and I possibly could not be here to play with my niece and nephews right now.
That's so interesting, because so many people deal with that. And what I find really interesting about what you say that I want to touch on a little bit is how you said that your cholesterol is normal, but I don't exactly know how it looks, but I'm envisioning that you're saying that it's sticky.
Yeah.
So, no one thinks for their doctor to tell them, oh, your cholesterol is normal, but the texture of whatever's in your body is the kind that's going to clog your arteries maybe in the future.
Right.
Why aren't we more educated on that?
So the reasoning is because my type of patient population that has that genetic variation is probably 20%. So the way that healthcare works right now is if you're in the 50% that's going to be in the norm or the majority, then they're going to focus on screening those people because they're going to get the majority. I'm kind of an outlier. I'm in that 20% outlier. So funding and the way that medicine has been created is to focus on the mass group, and then everything else is kind of left to kind of just be there.
And what about on the 20% people? Because I've been that person too. I have a video about it, how my acid reflux medication gave me an autoimmune disease. If you Google the studies, it says 20% of people have this side effect. And that's a lot when you think of the entire world. And I went to the doctor with this study and said, I think I'm one of these 20%. And they still said no, even though there was all this data and research, not only from a study, but from talking with me and me having photos and dates correlating with things, and they still were in this world saying no, keep taking the medicine. Why is that happening? Because that's making people more sick.
And the reasoning is it's more just the way healthcare is. But the good thing from that is it's allowing doctors like myself to kind of build our own practice and focus on that. And so what I like is that functional medicine doctors are now created, and they just focus on that. So for those 20% like myself, like you, we have our own little niche of doctors now that can focus on that. And we still have our primary care doctor that can screen us for everything else in the majority, but now there's nice to have these little niches of doctors that specialize in things just like we're saying. And you having a talk show like this to grow awareness is so helpful, so that way those patients that do feel like they're not crazy like they've been told, but there is something wrong with them, and then they're the 20%, that they have an outlet to go to feel better.
That's what I want people to know, because whether it's depression, which is obviously serious and you should seek help, or anxiety, or you have a stomach issue, or any issue, that you're not crazy and you don't necessarily need to take medicine, that maybe there's just a little thing off in your body.
And on that topic, that is such a popular topic, anxiety and depression, and and mood changes. And a lot of times when patients come in, we go directly to go to counseling, or here's a prescription, without knowing what exactly the imbalance is. Now we have neurotransmitter testing, which we can actually, just with a simple urine test, look at all the neurotransmitters, see which ones we need to focus on. And that not only helps us to have a safe way to balance your hormones, your neurotransmitters, so you feel better, but also if in the future, if you did need to be put on a medication, we can put you on the correct one versus guessing and giving you harmful ones, because we know exactly what's going on with your neurotransmitters.
And what's really interesting too, this happened to my mom when I was little. When I was probably 2 years old, she went through some sort of depression, and we're not depressed in my family, or really, I'm really as happy as I seem in all my motivational things. And so is my mom, but she went through this period of time where she was depressed. And I remember, I think she went to a doctor, and a good one, and they just said, oh, you have a vitamin deficiency. Take this vitamin and it will run its course. I think it took a couple months. It might have even taken a year, but she knew it would pass, and all she needed to do was take a vitamin.
Yes.
It's like, if other people really knew that and realized that sometimes your body gets out of whack, it's like breaking a bone. Like, your knee, if it's broken, doesn't heal. It takes 6 months and then physical therapy for a year to heal. Why is your mind or any chemical in your body different?
And that's a great question. So a lot of times when we start getting mood changes, one, you're absolutely right. It could be a vitamin deficiency. It could be stress. Like your stress hormones can be imbalanced, causing your body to be in a stressful mode all the time. And just meditation and relaxation can help with that. There's also things like, especially like elder women, when they're going through like the change, like menopause, their hormones are fluctuating. And those same symptoms of hormone fluctuation can be similar to like severe anxiety and depression. And these women, similar to your mom, they may have thought like, my whole life I've never depression, and they actually feel like nothing's wrong, but their body just feels like they're depressed. And all we have to do is take a closer look at their hormones, naturally balance them with nutrition, diet, exercise, or a safe way to replace the hormones, and they turn out to be themselves again.
And there's only a few minutes left, but one thing I really want to ask you about as well is sleep. My mom always said sleep cures everything. And you know, when I've been my sickest that I felt, the thing that I tested that I noticed worked the best is if I just went to bed and woke up at the same time every day and exercised, I felt 100% better the days I did that. So what's the correlation with sleep? Because so many people say it's stress, and you want to be like, why are you blocking out stress and not sleep? But at the same time, is there something to that?
Yeah, so sleep is super important because when we get up in the morning, our body is in a mode of like, let's get things going. Your body wants to break down everything you have to get the day going. But at nighttime, it's like cleaning up a big mess, like a kid who just has a bunch of toys out. Your body wants to like clean that up so the next day you have a fresh start. And the only way it can do that is if you get enough sleep, because you're giving your brain enough time to get the whole body organized for the next day. And that even means to fight off infections, to get through a stressful day, to have a long day, whatever the energy you need. Your body knows if you give it like 6 to 8 hours of rest, it's going to even compartmentalize all your thoughts so you have a clear mind in the morning. And the best way, and with sleeping, if you're at a go, drinking a lot of caffeine, you're not taking naps, and you just go, your stress hormone is going to override everything. And it's going to tell your body, like, she's a machine. She doesn't need rest. We're just going to keep going. And it's not going to think about getting sick. It's not going to think about helping you prevent, it's not going to help you to use your metabolism good and lose weight. Instead, it's going to be like, you know what? She's stressed out. Let's just keep her going. And let's focus on go. And we're going to not worry about immune system. We're not going to worry about her losing weight. So what your body is going to go into a fat storage. It's going to go into a low immune system, but you're going to keep focusing because your stress hormones are going to be high. And that is going to really affect the way that you sleep in the end. You're not going to be able to sleep because your body is not trained to do that anymore. So you have to train yourself that, okay, 10 o'clock, I'm going to turn the lights off, get into a meditation, sleep, or you just got to tell yourself to slow down during the day so you can catch up on that sleep at night.
And then if you don't get that rest, do people break down? Isn't that what causes really being sick?
Yes.
Being unhappy and everything that we're dealing with.
Absolutely. If you don't get that rest, then you're telling your body that you pretty much, don't need it, and that it's pretty much doesn't have enough time to heal and just work the way it should work. It just, when it's on stress mode all day, it's going to ignore the basic functions of helping with immune function and anything else. And it's just going to keep your mind wired, which can be dangerous too.
So what are like the 3 main things that someone can do if they're watching this video and they say, hey, that sounds like me. I have something going on and I want to fix it. How can they get started?
Sure. So the first thing is to make a list of things that are bothering you and not ignore them. Even if your doctor has said, oh, it's nothing, make a list. And then second thing would be to go find like a functional medicine or specialist in all over California. There's plenty of them, actually across the United States. And 3, be an advocate for your health. Don't be okay with, this is just the way I'm supposed to feel. If you feel like you want to feel your best and that something's being missed, then actually be an advocate and do whatever you can. And a lot of us, like myself, we always give 20-minute free consults because we just want you to come in. Don't be afraid. And I'm not the only doctor that does that. Many functional medicine doctors will say, come in for 20 minutes. Let's just chat. It's really relaxing, just like this. Mm-hmm. We make it very comfortable so you can talk to us. And we're honest with you. We're like, okay, with your symptoms, this is what we would do. And that way it's not like pressure. And that way that there's somebody out there that can help you out
and figure out and find
Absolutely.
These little things that are causing the problem. There is hope. Well, thank you so much for coming to the show today. Can you let everyone know where they can find you?
Sure. Thank you again for having me. I have my own private practice in Newport Beach, and the best way to contact us is through my website, which is www.yerelpatelmd.com.
Yeah, and thank you guys so much for watching. If you want to binge all the episodes right now that aren't out on my YouTube channel, if you're watching this on YouTube, you can go to EverTalk TV or the EverTalk TV app. You can always find me on YouTube at Lindsay B. Hoffman. I'm that across all social media and my website, doseofbliss.com. We also have, what's your socials or your pages where they can find you?
So for Instagram, it's Dr. Yerel Perfect Youth. And then my website is www.yerelpatelmd.com.
Thank you guys so much, and we're going to get you guys the help that you guys need, just like me. Thank you so much.
You're so welcome. My pleasure. Thank you for having me.
Bye.
Bye.